The drug index. Welcome to the drug index. Health is wealth. So we are going to see tranexamic acid. Before we start about this drug, it is usual for females to have the menstrual cycle. So during that period, they might experience a heavy bleeding. So if they experience heavy bleeding or heavy periods, so they should take this drug called tranexamic acid. So let's see more about this. Tranexamic acid, sometimes shortened as TXA, is a medicine that controls bleeding. It helps your blood to clot and is used for nosebleeds and heavy periods. If you are having a tooth taken out, using tranexamic acid mouthwash can help to stop bleeding. Tranexamic acid can also help you if you have a condition that causes swelling under the skin, which might be hereditary angioedema. If you have any condition that causes you to bleed more than usual, you need to take tranexamic acid too for a few days before having a surgery or then surgery. Tranexamic acid comes as a prescription, as tablets are there of this drug, liquids are there for this drug for children or people who are finding it difficult to swallow. Mouthwashes are there, and also injections are there, which are usually given in the hospital, not like giving it to someone to take it out. Tranexamic acid tablets for heavy periods are also available to buy from pharmacies for adults aged above 18 years or from 18 and above, not only above 18, from 18 and above. There are some key facts about this drug. You will usually take tranexamic acid for a few days at a time. You can take the tablet with or without food, so it has no food interaction. Most people do not have any side effects when taking tranexamic acid, so it sounds safe. If you also take the combined contraceptive pill, there is an increased risk of deep vein thrombosis with tranexamic acid. Brand names of this drug include cyclocapron, cyclo-F, and menstrualite. So if you go to the market, you tell them this tranexamic acid, they don't understand, you can give them these brand names, so they will be knowing how to help you, because it is a very important drug. And you might ask yourself who can take it or who cannot take it. The answer is tranexamic acid can be prescribed for adults and children of all ages. That is not limited to any age. Tranexamic acid is not suitable for some people, actually. To make sure tranexamic acid is safe for you, tell your doctor before this medicine if you have had an allergic reaction of tranexamic acid or any other medicine in the past. Have you ever had a deep vein thrombosis or pulmonary embolism, which is blocked blood vessel in your lungs? Have had a coagulopathy, but this is a rare condition where lots of small blood clots form in your blood followed by abnormal bleeding. If you have ever had epilepsy, kidney problems, or pregnant or trying to get pregnant, have irregular periods. So those are the conditions. Before a doctor prescribes this drug for you, you should tell your doctor that I have these ones, and these ones, so that you might be safe. How and when to take this drug? You might ask yourself. If you are prescribed tranexamic acid tablets, you can take them with or without food, as I had said earlier. If you have told to take the tablets 3 or 4 times a day, try to space the doses evenly throughout the day. If your dentist has prescribed tranexamic mouthwash, This might come as a ready-made mouthwash or as a tablet that you mix with water. Follow the instruction that will be given to you by the dentist who gave you the drug. And another one about the dosage forms. Tranexamic acid comes with as 500 milligram tablets. For adults, the usual dose is 2 or 3 tablets taken 3 times a day. Doses are usually lower for people with kidney problems, as we saw that they might experience other problems if they take a lot of it. The liquid comes in different strengths. Follow the instruction on the label to make sure you take the right dose. If your children is prescribed tranexamic acid, the doctor will use your child's weight or age to work out the right dose to be given to your child. Will my dose go up or down? Most people taking tranexamic acid take 2 tablets, which should be 1000 milligram a day, 3 times a day, or maybe it depends. If this is not working well enough to control bleeding, your doctor may tell you to take 2 tablets a day, like 2 tablets 4 times a day. What if I forget to take my dose? What happens, or what can I do? If you forget to take your dose of tranexamic acid, take it as soon as you remember, unless it's nearly time for your next dose. In this case, skip this missed dose and take the next one at the usual time. Do not take 2 doses at the same time. Never take an extra dose to make up a forgotten one. If you forget doses often, it might be good for you to set an alarm or talk to your doctor on how you can manage to remember the time. What if I take too much? Taking 1 extra dose of tranexamic acid by accident is unlikely harm to you. However, if you take too much, you may get side effects. This can include feeling or being sick, diarrhea, dizziness. Speak to your doctor if you are worried if these side effects are troubling you. The other side effects, like all medicines, tranexamic acid can cause side effects, although not to everyone. Common side effects include feeling sick, nausea, diarrhea, itch skin. The most serious one, side effects might happen in 1 out of the 1,000 people, but they include serious allergic reactions. In rare cases, it is possible to have serious allergic reactions, which are anaphylaxis to tranexamic acid. These are not all side effects of tranexamic acid. For a full list, see the leaflet inside your medicine pack, because if you are given, they show you everything about this drug. So before you take it, you can read the leaflet that will be put in the packet of your medicine. How can I cope with my side effects if I'm taking this drug? Like, what can I do about it? Like feeling sick or having this nausea. If you feel sick after having the injection, it may help you if you avoid rich or spiced food, if it carries on all the effects or even severe, or tell your doctor. They may be able to prescribe an extra medicine to help you treat these symptoms. And if you are having diarrhea, if you get diarrhea after having the injection, drink plenty water to avoid dehydration. Signs of dehydration include being less than usual or having dark or strong smelling pee. Tell your doctor or pharmacist if it carries on. Sometimes reducing the dose helps. Itch, red skin. Apply a soothing cream such as a moisturizer, at inch cream, or a lotion. If the skin is dark rate get worse or carries on for more than a few days, speak to your doctor directly. How about during pregnancy and breastfeeding? Tranexamic acid is not usually recommended if you are pregnant. This is an attention that you should take. This is because there is not enough information to say whether it's safe. So if there are not such kind of information, it's safe for you not to take it. However, your doctor may prescribe if they think the benefits of the medicine outweigh the risk. If you are pregnant or trying to get pregnant, talk to your doctor about benefits and possible risks of taking tranexamic acid. And tranexamic acid during breastfeeding, small amounts of tranexamic acid may get into breast milk. However, medicine is generally considered as safe for breastfeeding mothers and babies. Talk to your doctor if you have any concerns about taking tranexamic acid during breastfeeding. There are some cautions with other medicines. Tranexamic acid can be taken with most other medicines. However, talk to your doctor or pharmacist if you are taking the combined pill. There could be a very small increased risk of getting a blood clot if you take tranexamic acid as well. Mixing tranexamic acid with herbal remedies or supplements. There is no enough research to say whether a herbal remedy or supplement are safe to take with tranexamic acid. This is because they have not tested in the same way as prescription medicines. This is an important note. Tell your doctor or pharmacist if you are taking any other medicine, including herbal medicines or herbal remedies, vitamins or supplements, so that they can know how to deal with you to get okay. Drug index. Health is wealth. Like, comment, share, and subscribe for more. Stay in touch.